natural. It sounds safe, gentle, and healthy.
And that's why so many people turn to herbal supplements, hoping to boost their health and extend their lives. And I see it all the time at our functional medicine clinic. Patients come in with a long list of supplements, and some of these supplements are better known and relatively well studied, and they can truly be effective. But others are completely unknown. Some mystery blends where it's not even clear what they do, how they were made, or whether they are safe. And here's the real problem. While some supplements are tested for quality, there is no single uniform agency making sure that every product on the market is safe. And that gap leaves patients vulnerable, thinking that they're helping their health when in reality they may be putting their liver and other organs at risk. Today, in this video, I will name some of the most popular supplements that have been implicated in liver damage based on the latest medical data. And I want to be clear that this is coming not from a supplement hater, but from a supplement lover, a functional medicine doctor who recommends supplements every day, but who is always preoccupied with their safety. Welcome back. I'm Dr. Maria Azizian, a board certified general surgeon and an IFM certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So, recent publication in Medscape Gastroenterology and Hepatology highlights called attention to this growing issue, and the link is in the description of this video. So, first, let's throw a few numbers. The supplement industry in the US is enormous, worth more than 60 billion every year, with over 80,000 different products available, and many are marketed for wellness, weight management, or chronic health support. But studies show the risks are climbing. According to the US Drug Induced Liver Injury Network, the number of liver injuries linked to supplements has tripled from 7% in 2004 to 20% by 2013. And that percentage continues to rise. So, something people take for wellness can sometimes lead to the exact opposite, serious liver damage. So, let's get specific and let's talk about some of the most popular supplements that may be hurting the liver. And you may recognize some of these from your own kitchen or supplement cabinet. So, as I'm about to list supplements that have been implicated in liver injury, I have to reiterate that this does not mean that they are automatically bad or automatically dangerous for everyone. The risk usually arises in three situations. First, when they're taking in excessive amounts, and that's the most common situation. Second, if someone already has underlying liver problems and taking the supplement. And third, in people who are genetically predisposed, such as lacking certain enzymes needed to safely metabolize these compounds. So the first one is turmeric. Turmeric is often praised as the golden spice of health, and it's a great supplement. It's added to smoothies, teas, and capsules, and many people take it for example, joint pain or general inflammation to boost their immune system. But here's the twist. Reports show turmeric can trigger hepatitis, and hepatitis is the medical word for liver inflammation. When the liver gets inflamed, it can't process toxins, fats, or hormones properly. And here are some common symptoms of hepatitis: fatigue, feeling unusually tired or weak, loss of appetite, not wanting to eat, and sometimes with nausea or vomiting. Abdominal pain, especially on the right side where the liver sits. Dark urine, tea, or cola colored, pale or clay colored stools from reduced bile flow, jaundice, yellowing of the skin and eyes, itching, low grade fever or flu like symptoms, sometimes seen early on. So, what's more, the risk seems to rise when turmeric is paired with piperine. That's a black pepper extract, which boosts absorption but also interferes with how the liver handles medications. So, instead of being protective, turmeric can sometimes backfire. Number two, green tea extract. Drinking green tea, generally safe. It's great. But concentrated green tea extract, the kind that you find in weight loss pills and detox products, is another story. It contains high levels of catechins like EGCG, and at those doses, the liver essentially gets poisoned, and this can cause hepatitis as well. And in general, think of it this way: your liver is like a filter. A gentle trickle of green tea is fine, but when you dump a whole flood of concentrated extract into it, the filter clogs and breaks down. Number three, kava. Kava is advertised as a natural relaxant, helping with stress or anxiety. But in some people, kava has been linked to fulminant liver failure. That means that the liver suddenly stops working, and sometimes so badly that the only option is a transplant. Some countries have banned kava because of this risk, but in the US, you can still buy it online. And that's what makes it so dangerous. People think that they're just sipping on this calming herbal tea, but in rare cases, it's a straight path to liver failure. Number four, black cohosh. Many women use black cohosh for menopausal symptoms like hot flashes, but case reports show it can cause, again, hepatitis and even cholestatic injury. Now, what does it mean? Hepatitis is an inflammation of the liver cells themselves. Cholestatic injury is a little different. It means the bile, the digestive juice made by our liver, gets stuck and can't flow properly. So imagine your liver as a factory that makes bile, and the pipes carrying it out get clogged. So the pressure builds up, leading to itching, dark urine, pale stools, and jaundice. So what started as a natural solution for hot flashes can turn into a very unpleasant liver crisis. Number five, usnic acid. And this one shows up in a weight loss supplement, but the problem here that usnic acid may be directly toxic to liver cells, and again, it may cause sudden severe hepatitis and even liver failure. And several young, otherwise healthy people have landed on liver transplant lists after taking weight loss products with usnic acid. And it's marketed as a fat burner, but in reality, it's your liver that's being burned out essentially. Number six, traditional Chinese and Ayurvedic remedies. These remedies come with centuries of cultural tradition, and there is a lot of efficiency, youth, and wisdom behind them. But in modern practice, testing has revealed that some may contain heavy metals like lead, mercury, or arsenic, or they are adulterated with undeclared pharmaceuticals. So specific products like Jin Bun Huan and Chow Chai Fu Tang have been linked to, again, hepatitis and cholestatic injury. And the problem isn't just the herbs themselves, but the fact that patients don't always know what's inside the capsule. And it's like taking a mystery pill. Sometimes it's safe and sometimes it's toxic. Number seven, noni juice. This superfood is sold as an energy booster and immune tonic. But several cases have linked noni juice to hepatitis. And again, hepatitis means that the liver swells up and can't do its job. So instead of boosting health, it's silently causing damage. Number eight, multi-ingredient blends. And these are perhaps the riskiest of all. Think of the detox kits, immune boosting powders, or weight loss blends. They often have dozens of herbs and extracts mixed together. And the labels may look very impressive, but in reality, it's a chemical soup for your liver. Some have even been found to contain undeclared pharmaceuticals, hidden drugs added in to make them work. And others combine herbs that amplify each other's toxicity. So in these cases, it's nearly impossible to figure out which ingredient is to blame. For the liver, it doesn't matter. The damage is already done, essentially. So another challenge posed by damage from these supplements is diagnosis. Patients often don't mention their supplement use because they assume it's safe. But the symptoms, for example, fatigue, jaundice, abnormal liver enzymes, can look just like viral hepatitis or autoimmune hepatitis, or even hepatitis due to prescription drug injury. In addition, many doctors don't know much about supplements, and they usually figure out that the liver damage was due to the supplement retrospectively only after ruling out other causes or noticing improvement once the supplement is stopped. So you may ask, why is this happening? So part of the issue is regulation. Under the 1994 Dietary Supplement Health and Education Act, supplements are treated as foods, not drugs. And that means that companies don't have to prove safety or effectiveness before marketing. The FDA can only step in after harm has occurred, and this system leaves consumers exposed. Additionally, one of the biggest hidden risks is duplication. Many people take multiple products, for example, multivitamin, detox products, immune boosters, without realizing that they contain the same herbs or extracts. That means they may accidentally double or triple the safe dose, overwhelming the liver. And this overlap is one of the key reasons behind the rising cases of supplement induced liver damage. So, the bottom line is this: herbal supplements may look safe, but they are not harmless. Both patients and medical providers need to approach them as active medications with real effects and real risks. And as a functional medicine doctor, I want to emphasize again, I'm not anti supplement. I use them every day in my practice, and they can be powerful healing tools when used wisely. But the key is safety and personalization. In our clinic, I spend a great deal of time carefully reviewing each patient's supplements and creating new functional medicine protocols. It's a detailed and very tedious work, matching existing supplements with my new recommendations, checking for duplications, and also looking for potential interactions also with prescription medications. And that's why it's so important to always inform your doctor about everything you're taking. And we, the medical professionals, should keep educating ourselves to become savvy in this huge and expanding world of supplements. And for the patient and supplement consumer, please take the time to educate yourself about your own supplements. Know what they are, what they claim to do, and how they may affect your health. That may save your liver one day. Thank you so much for watching. Please like, share, and subscribe if you enjoyed this video. I'm looking forward to reading your comments. Until next time. Bye-bye.